A warm welcome to you on this enlightenment program, Half Hour of Hope. This program focuses on the activities of the wife of Abia State Governor. For your comments and questions, send SMS only to the number 0701 538 3628. And in case you're wondering, my name is Chinezerem Abakuru.
News updates.
Wife of Abia State Governor has many intervention packages for the women and children in the state. The Half Hour of Hope crew sought to know her vision for this group of people in the state. For even the Holy Writ says that where there is no vision, the people perish.
My vision for women of Abia is a place where opportunities abound for their self-realization, where they can be healthy, happy, prosperous, and secure.
Showcase.
Today on this segment, we shall be handling an educating topic that says more on sickle cell disease. Our guest is Dr. Grace Onyike, Senior Registrar, Department of Community Medicine, Federal Medical Center, Umuahia. Dr. Grace, it's good to have you on the show today.
Thank you very much.
Our topic today says more on sickle cell disease. That means we want to talk about sickle cell disease and some of the aspects of sickle cell disease. Now, may we begin by asking you what sickle cell disease is?
Okay, thank you very much for your question. Sickle cell disease is actually a genetic disorder. And what do we mean when we talk about genetic? It means it's something that's inherited maybe from your mother's side or from your father's side. And usually sickle cell affects the red blood cells, making the blood cells like a sickle. A normal red blood cell is usually rounded, but usually when someone is said to have sickle cell, the red blood cell looks like a sickle. And normally in sickle cell disease, the red blood cells become very rigid, meaning that at the end of the day, oxygen is not able to move adequately throughout the body and hence causing the symptoms of sickle cell disease.
For a child who has sickle cell disease, what are the symptoms?
For a child who has sickle cell disease, the first symptoms what we usually call anemia. Anemia means, in layman's words, shortage of red blood cells.
Okay.
Usually you say the person is looking very, very pale. The person doesn't have enough blood to carry his or her to do whatever she needs to do in life. Now, apart from anemia, because you have shortage of red blood cells, most times the patient is always tired. Most times the person cannot do the normal things he or she is supposed to do for her age because of shortage of blood, which is anemia. Then also we have one of the commonest symptom is pain. A lot of joint pains, a lot of all sorts of pains. If you see a child in sickle cell crisis, they're always in pains, and these pains can make the child cry, make the child not go to school and enjoy the things he's supposed to enjoy with other children. Then for little children, babies less than 2 years, there's painful swelling of the hands and the feet. You usually see those ones in the younger children. Then also they are also prone to a lot of infections, like especially pneumonia. That's one of the major infections. They're actually very prone to pneumonia because usually the spleen is what helps in fighting some of the infection, and then but the sickle cells usually tend to affect the spleen. And then once the spleen is affected, you'll be able to fight some of the infections that can come. A normal person that has normal red blood cells can fight some of the infection, but someone that is sickle might not be able to fight these infections because it's affecting the spleen, which helps in fighting some of these infections, especially pneumonia. Then also you can have delayed growth in some children too.
Okay, does it also affect a child with respect to walking movement? For instance, could it delay a child from walking at the normal age he or she is supposed to?
Yes, it can.
Really?
Yes, it can. It's part of the delayed growth. Yes, it can.
Okay. Now, what are the complications?
Okay. Some of the major complications we have for sickle cell, some people come down with stroke. You will just see a young child, you will think it's only elderly people that get stroke. Most times when we see children that come in with stroke, at the children outpatients, at the children emergency department, most times you just have to query that person is probably a sickler until proven otherwise, because that's one of their major complications of this stroke. They also have acute chest syndrome. This usually affects them. You see a child coming breathless, unable to breathe, and holding the chest as in pains. Most times that's one of the complications. It can also lead to blindness, because of the small vessels of the eye can also be affected. Can also lead to leg ulcers. You see a young lady having ulcers on the leg that refuse to go. Most times you need to check the genotype of that patient. For younger people that have leg ulcers, we tend to think of sickle cell. It can also damage any of the organs, especially mostly damages a lot, as I said before, the spleen. Then for the male sickle cell patients, they can also have what we call priapism. This is where they have sustained delayed erection. They will have erection for a long while, as in the erection is just sustained, and that can be very painful. Okay. That's some of the complications. Then we can also talk about the psychosocial issues. Some of these children, because they're sickler, some of them have a specific species. If you see a sickler, sometimes you can know they have this protrudent forehead. Their eyes are always yellow because of jaundice, because of the breaking down of red blood cells. Their eyes could be also yellow. And then when they go to school, now little children can have some psychosocial problems. They'll not be able to move around with their mates, or they are also prone to a lot of peer pressure and any issues that come to
children,
social. Yes,
they could even start asking them, why are your eyes like this,
or why is your head protruding like this? You are not normal, or anything like that. So those are part of the psychosocial complications that can come with sickle cell.
Okay, having said all of that, I think we need to talk about how the sickle cell can be managed.
Yes, it's quite important. For us in the community medicine department, or in general, we always believe in prevention. As this adage says, prevention is better than cure. So we always believe in health education, telling everybody that it's better you know your genotype on time. As young as you are, as maybe you're old enough to know what you're supposed to do, as a parent, you should always know your children's genotype, and also make sure that they also know their genotype for further use. So we talk about early identification is very, very important. Right now, you can actually know your genotype, what we call neonatal screening. As the child is even born, they can be able to take the blood from the heel and know the child's genotype. So it's always good to know your genotype as early as possible. We talk about health education. Counseling is very, very important to people, especially when it comes to the aspect of getting married. We have seen people that want to get married and one is AA and the other person is SS, or we have two AS coming together. You need to counsel them. And then most times now, so in churches, that you must do your genotype before you walk down the altar. Also, vaccination is very, very important, especially for these children. As I said, they come down with a lot of pneumonia.
Okay.
So there's a vaccine we call the pneumococcal vaccine. It's given in FMC PCV.
Really?
Yes, it's given at 6 weeks, 10 weeks, and 14 weeks. And it's usually good for those that have sickle cell to prevent them from coming down with pneumonia.
Okay.
Then that's part of the beginning when we talk about prevention, health education. Then when we come into the treatment proper, usually treatment is aimed at avoiding crisis, relieving symptoms, and then preventing these complications. So usually we treat the infections with antibiotics, example penicillin. Then for those that come in acute pains, what we call sickle cell crisis, we usually give them pain relieving medicines. The example like ibuprofen is also given to reduce their pain. Then also we also have to treat for malaria. Malaria is very important in treating for people that are living with sickle cell disease, because we found out that they tend to have malaria more often. Those are sickle cell patients. So we always treat them constantly for malaria. And malaria also, malaria grows them to getting crisis more often. So that's why they're usually on treatment for malaria to reduce their crisis. Okay. And then also, for those that come in crisis, you usually try to rehydrate them with a lot of fluids. We are told that those that are sickle cell, they should tend to drink a lot of water to avoid having sickle cell crisis. And for those admitted in the hospital, they need blood. Usually we also give them blood transfusions.
Now, you said something about penicillin, ibuprofen.
Yes.
Do you encourage self-medication?
No, we don't encourage
especially for this sickle cell patients.
We don't encourage self-medications, actually. So what I'm trying to say, if you find yourself having a crisis, it's always good to go to the primary health centers, or you come down to the tertiary health centers like FMC, come to the emergency where you'll be treated.
You're a staff of FMC.
Yes, I am.
How quickly can they get attention when they get to FMC?
Oh, they can get once they come through the emergency unit. There's prompt attention. They can get once they're in any sickle cell crisis. There are people to see immediately.
Okay.
Yes.
But do you have ongoing treatments and consultations for them?
Yes. For the adults, they have their days. And I know for the children, they have a sickle cell clinic for pediatrics in FMC, where they only see and treat children with sickle cell disease.
Okay. Now, for parents who have sickle cell children, what do you advise them? Because they will not always live in the hospital. They will always be in the hospital.
Yes.
But there has to be a way they can manage these children so they don't go down with crisis all the time.
Okay. Well, there's some lifestyle and home remedies that we talk about. One of the, when you usually, as a sickle cell patient, usually you are advised to take your folic acid supplements daily. And also for parents, you choose a healthy diet that your children should also, for your children, to avoid or limit the amount of processed foods like all this ice cream and all those things, but give your children healthy diet.
You mean
also,
organic foods?
Organic foods, yes. Also, you as a parent, make sure your child drinks a lot of water. For adults, we are advised to take at least 8 glasses of 1 and up to 1.5 liters of water, the big size ever. One thing we need for your children, they have to be rehydrated. They should always be rehydrated. And then we try, as I said, we have to try to avoid dehydration, because dehydration can increase your risk of sickle cell crisis. So parents that have children with sickle cell should always monitor to make sure that they're always drinking water. And also they need to avoid extremes of temperature.
Okay.
When it's very cold, you need to cover them, and also when it's very hot, because as I said, now when we get to the dry season, you have to make sure that they are not always covered, and make sure that they drink a lot of water. That's what we mean by avoiding temperature extremes. And also parents also need to be educated, and they also educate their children about the symptoms. Like if a child comes in as a sickle cell patient and says, mommy, I'm having pains, you shouldn't take it lightly. You should know that I need to take this child to the hospital immediately. She could be entering sickle cell crisis. So we should try to avoid having, for children with sickle cell, we have to avoid them having physical labor, because as in anything that has to do with stress, for the fact that they already have their red blood cells are not normal, maybe a normal person, but you have to try to do everything you can to avoid giving stress to that child. Anything hard labor, physical labor should also not be done for a child that has sickle cell disease.
Let's have your parting shot on the show for parents who have children with sickle cell disease, and for the warriors, those patients. We like to call them warriors because we know they've fought a lot of battles. Sickle cell disease is not, from what I understand, is not a very easy ailment to fight. So for all these ones who have come through, who are still battling and have battled and are still alive today, we'd like to call them warriors. So for these warriors, do you have something for them?
Okay, for the warriors, it's having sickle cell disease is not a death penalty. It's not a death sentence at all. I know a lot of people that have able to live their life to their greatest, to their fullest, with sickle cell anemia. But it's just that for you, as a warrior, you should know the things to avoid, so that to avoid getting crisis. I know people that have stayed 2-3 years, they're sickle cell patients, but have not had crisis in a long while, because they are doing what they're supposed to do. They take plenty of water, they avoid hard labor, they avoid anything that has to do with stress. They can live a normal and long life if they just avoid some of these strenuous things. Stress.
I think that's very heartwarming. Thank you very much. Sickle cell disease is not a death sentence. I think that's quite cheery, and that's heartwarming for everyone who is a warrior. Our hearts are with you, and our prayers too. More on sickle cell disease was handled by Dr. Grace Onyike, Senior Registrar, Department of Community Medicine, Federal Medical Center, Umuahia. Thank you, Dr. Grace, for coming on the show today.
Thank you for inviting me.
Dear listener, in case you want to ask questions about what we have just talked about or about anything on this program, please send SMS only to the number 0701 538 3628. 0701 538 3628. If we get your question, we will get to the doctor or whoever that question is directed to, get answers from the person, and make it available to you in the next edition of our program. And if you want to know more about sickle cell and what Mrs. Ibazo, the wife of the governor of Abia State, is doing, Visit www.vicarhopefoundation.org or check out our Facebook and Twitter pages at twitter.com/vicarhope or facebook.com/Vicar Hope Foundation, or visit YouTube channel to see what's up.
Ladies and gentlemen, gossip day for town.
Kedu ihe iche na-eme nwanne be anya?
Ị dị sure ọ bụghị ọgbanje?
Nke bụ na ekwesịrị ka chọọ ya mmụọ ọjọọ.
Makwa family deliverance.
O nwekwara ike bụrụ ndị village bịara ọgụ.
Makwa mụ.
Hell, she. Ọgbanje, on the village bịara ọgụ, or deliverance. I agbaru na agbara. Ignorance in high places. Get to learn more about sickle cell disease and its management, plus other interventions of the Office of the Abia First Lady on the program Half Hour of Hope every Wednesday at 11:05 a.m. on the dial 88.1 FM Umuahia. Half Hour of Hope, insightful, rich, incisive, rewarding. 11:05 every Wednesday morning on 88.1 FM. Join us.
Life comes once you have to live it as best as you can. Remember, the deadly illness sickle cell can be stopped if you know your genotype and avoid having a child with someone who is not compatible.
HIV is real and it's very much around. Be safe.
Constantly watch out for illnesses like diabetes and cancer.
Our children are the future. We must educate them and protect them from all sorts of abuse.
Your environment is important. Always keep it clean. We are Vicar Hope Foundation. We believe that working together, we can improve our society. At Vicar Hope Foundation, we provide houses for the indigent and empower people with skills and equipment. We care about health, environment, education, and enhance the moral values of our people. Support us today at Vicar Hope Foundation. We are your partners in making the world a better place. Vicar Hope Foundation. Hope for all.
Tidbits from the Office of the Abia First Lady. On Tidbits today, do you know that breast cancer remains the major killer for women all over the world? Honestly, breast cancer is the most invasive and most common kind of cancer in women. But then, the good news is that Vicar Hope Foundation has acquired a mammogram machine for diagnosing breast cancer. Yes, and the beautiful thing is that you can have access to its services at Vicar Hope Mammograph Center, Block 2, Vicar Hope Foundation, 183 Ndume Otuka Bypass, opposite New Secretariat, Government Station Layout, Umuahia. And just recently, a team of Catholic children, the Holy Childhood Association of Catholic Diocese of Aba, who took the first position in singing and Latin competitions held in Nigeria and Rome respectively, paid a courtesy call on the wife of the governor to present their trophy. Oh, I wish you heard them sing. And that's not all. Not too long ago, a team of officials from the Aisha Buhari Foundation visited the state to discuss the objectives of forging closer ties with Vicar Hope Foundation, pet project of Mrs. Nkechi Ikpeazu. During the visit, the team inspected facilities of the Vicar Hope Foundation, which include the Sickle Cell Center, the VHF Youth Center, the Mammography Center, the VHF Diagnostics Center, and the VHF Resources Center, which serves as headquarters for the Widows and Indigent Shelter Scheme Program, and then the VHF Springboard Skill Acquisition and Empowerment Program. May you know the meaning of happiness, and may the best in your todays be the worst in your tomorrows. That's our prayer for you.
May you have auspiciousness and causes of success. May you have the confidence to always do your best. May you take no effort in your being generous, sharing what you can, nothing more, nothing less. May you know the meaning of the word happiness. May you always lead from the beating in your chest. May you be treated like an esteemed guest. May you get to rest, may you catch your breath. May the best of your todays be the worst of your tomorrows. Whoa. May the road less paved be the road that you follow. Oh. Well, here's to the hearts that you're gonna break. Here's to the love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got free pass. Here's to the fact that I'll be sad without you. I want you to have it all. I want you to have it all. I want you to have it. I want you to have it all. May you be as fascinating as a slap bracelet. May you keep the chaos and the clutter off your desk. May you have unquestionable health and less stress. Having no possessions, though immeasurable wealth. May you get a gold star on your next test. May your educated guesses always be correct. And may you win prizes shining like diamonds. May you really own it each moment to the next. Or may the best of your todays be the worst of your tomorrows. Whoa. Or may the road less paved be the road that you follow. Whoa. Well, here's to the hearts that you gonna break. Here's to the lives that you gonna change. Here's to the infinite possible ways to love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got a free pass. Here's to the fact that I'll be sad without you. I want you to have it all. All you can imagine, no matter what your path is, if you believe it, then anything can happen. Go, 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 raise your glasses. Go, 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 you can have it all. I told you, here's to the hearts that you gonna break. Here's to the lives that you gonna change. Here's to the infinite possible ways to love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got a free pass. Here's to the fact that I'll be sad without you. I want you to have it all. I want you to have it all. I want you to have it. I want you to have it all. I want you to have it. Here's to the good times we gonna have. Here's to you always making me laugh. Here's to the fact that I'd be sad without you. I want you to have it all.
That track, Have It, by Jason Maz, signals the end of the program Half Hour of Hope, brought to you by the Office of the Wife of the Governor of Abia State in collaboration with Vicar Hope Foundation, as packaged by the media team. For your questions and other inquiries, send SMS only to the number 0701 538 3628. Half Hour of Hope returns same time next week. I, Chinezerem Abakuru, have been your hostess.